Hello everyone, this is Dr. Sam and this video is about MRI of the uterus. This is a T2 sequence of the pelvis and here is the uterus. The uterine cavity is slightly hyperintense, that is, it is slightly brighter, and the myometrium is hypointense with the junctional zone being much darker than the rest of the myometrium. This is the internal os and this is the external os. This right here is the rectum, and this potential space between the uterus and the rectum is the pouch of Douglas. This hyperintense structure, bright structure, is the bladder. This is how the normal uterus looks like in a T2 sequence in sagittal view. And over here is a case of Mayer-Rokitansky-Küster-Hauser Syndrome. It is also called Mullerian aplasia. There is absence of the uterus, cervix, and 2/3 of the vagina. Only 1/3 of the vagina is present. We do not see the normal uterus in the pelvis here. Here is another image showing Mullerian aplasia. We see some remnants of the uterus. These remnants are called uterine buds. Only the lower third of the vagina is seen. Here is a T1 sequence of the pelvis. The uterus is hypointense. The bladder is also hypointense. Now we will talk about fibroids, which are also called leiomyomas. Fibroids are benign tumors of the uterus. In a T1 sequence, they may appear isointense to the myometrium. Fibroids which appear homogeneous, such as in this image, are usually non-degenerated fibroids. They will have this type of homogeneous appearance. This is a T1 axial view of the pelvis. Here is the uterus and this is the bladder. This image shows the fibroid in axial view. It has low to intermediate signal intensity in a T1 sequence. This is a T2 sequence in axial view. This fibroid has a heterogeneous appearance, so this indicates that it is a degenerated fibroid. That is why it has a heterogeneous appearance. Now we will see the types of fibroids based on their location. This is an intramural fibroid. It is the most common type. The fibroid grows inside the myometrium. You can see that the fibroid is within the myometrium. This is a submucosal fibroid. This fibroid will occupy the uterine cavity. It will be found within the uterine cavity. A subserosal fibroid will grow outwards from the uterus and it will project outwards in this manner. This involves the outermost layer, that is the serosa. A pedunculated fibroid is connected to the uterus by a stalk. You can see a small stalk which attaches the fibroid with the uterus. These are pedunculated fibroids. This is a coronal view of the pelvis, and we can see the bladder over here and the uterus above the bladder. And this is a pedunculated fibroid in coronal view. You can see a large fibroid that is connected to the uterus by a stalk. There are different types of degenerations that a fibroid can undergo. One of them is hyaline degeneration. You can see a heterogeneous fibroid with hypointense areas on a T2 sequence. The hyperintense areas are due to cystic degeneration, which we will see further ahead. This is the uterine cavity, and over here is the rectum. Usually degeneration occurs in large fibroids due to the reduction of blood supply. This is a T1 fat saturated sequence of the pelvis. We can see a hypointense uterus. And this is a T1 fat suppressed contrast sequence. In axial view, we have two types of fibroids. The non-degenerated fibroid has homogeneous enhancement, whereas the degenerated fibroid has a heterogeneous appearance. A hyaline degeneration shows this type of enhancement. It has a reduced enhancement because the blood supply to the fibroid itself is reduced. That is why it does not enhance properly. The next type of degeneration is red degeneration. It is also called carneous degeneration. It is usually due to hemorrhagic areas. This degeneration will give a hyperintense signal in a T1 sequence. This is a T1 fat suppression sequence. The red degenerated fibroid still gives a hyperintense signal. In a T2 sequence, it can have variable appearances, but it usually has a hypointense signal intensity. This is a coronal image showing us a fibroid with red degeneration. Here is a T1 contrast fat suppression sequence. The red degenerated fibroid has no enhancement. In some cases, a red degenerated fibroid may have a high intensity peripheral rim and a low intensity center. This is a T1 fat saturated sequence in axial view. This is a T2 sequence. There is a low intensity peripheral rim and a high intensity center. As you can see, red degeneration has variable appearances. This is a case of cystic degeneration of a fibroid. We will find hyperintense areas in a T2 sequence. This is the fibroid with hyperintense areas in a T2 sequence suggestive of cystic degeneration. A myxoid degeneration is very rare. The fibroid is filled with gelatinous material and it can be difficult to distinguish it from other types of degenerations. This is a T1 fat saturated sequence. It will have a low signal intensity. This is a T2 sequence showing myxoid degeneration. It has intermediate to high intensity signals and has a heterogeneous appearance, but it also has a low intensity peripheral rim. We see a hypointense border. This is a sagittal view showing myxoid degeneration. It has heterogeneous, intermediate and high intensity signals. In some cases, we may find a low intensity peripheral rim in a T2 sequence. This type of degeneration is more likely to be found in a malignant case that is known as Leiomyosarcoma. This is another case of myxoid degeneration. We find a high intensity signal mass that is heterogeneous and it has a subtle low intensity peripheral rim. Also, we find a non-degenerated fibroid over here. It has a homogeneous appearance. In this image, we see multiple fibroids, and one fibroid has undergone a myxoid degeneration. The peripheral rim is more prominent in this image. This fibroid is a non-degenerated fibroid, hence it has a homogeneous appearance. Other sequences such as diffusion weighted sequence can be more helpful in evaluating fibroid degeneration. In this DW sequence, the myxoid degeneration will have high intensity signals and the low intensity signal will be found in a non-degenerated fibroid. Another sequence known as apparent diffusion coefficient or ADC is also helpful. We will still find high intensity signals from myxoid degeneration along with a heterogeneous appearance, and low signals will be seen from a non-degenerated fibroid. This is a T1 fat suppressed contrast sequence. The degenerated fibroid has heterogeneous enhancement, whereas the homogeneous enhancement is seen in a non-degenerated fibroid. These low intensity signals are from cystic areas. Now we will see different variants of fibroids. One of them is a cellular leiomyoma. Usually a non-degenerated fibroid will appear hypointense on a T2 sequence, but this type of fibroid has a hyperintense and a heterogeneous appearance on T2 sequence. Here is a sagittal view of a cellular leiomyoma. It has hyperintense and heterogeneous areas. In a diffusion weighted sequence, A cellular leiomyoma will give high signal intensity. This is a T1 contrast fat suppressed gradient echo sequence. The fibroid gives a hyperintense appearance. It is mostly homogeneous. By using different sequences, we can distinguish a cellular leiomyoma from other types of fibroids. A lipoleiomyoma is a very rare type of fibroid. The fibroid mostly consists of fat content. This is a T1 coronal view. This fibroid will appear hyperintense in a T1 sequence. This sequence is a T2 fat suppressed sequence. Due to fat suppression, the fibroid has reduced intensity and it appears hypointense. In a simple T2 sequence, the fibroid has a hyperintense appearance. This is a T2 sequence in sagittal view. The lipoleiomyoma has a bright, hyperintense appearance. Diffuse peritoneal leiomyomatosis is an extremely rare benign disorder in which there are multiple extrauterine and pelvic masses, which are usually fibroids. Some masses are small and some are large. Usually the small masses appear homogeneous and hypointense. The large masses have hypointense center and a hyperintense peripheral rim. This is the uterus over here, and this hyperintense structure is the bladder. This is a sagittal view showing diffuse peritoneal leiomyomatosis. We can see the large masses with a hypointense center and a hyperintense peripheral rim. And the small masses are homogeneous and hypointense. A Leiomyosarcoma is a malignant fibroid. It is also extremely rare. This is a T1 sequence in sagittal view. We find a heterogeneous hyperintense mass with irregular margins. These irregular margins are usually a sign of malignancy. This is a T2 sequence and it shows both benign and malignant fibroids. This mass is heterogeneous, hyperintense, and has irregular margins. Here is a diffusion weighted sequence. The leiomyosarcoma gives a hyperintense appearance. In adenomyosis, the endometrial tissue is found in the myometrium. In a T2 sequence, we will find ovoid, irregular, hyperintense cystic areas within the myometrium or just below the endometrium. Multiple subendometrial cysts are seen. Another feature is an increased junctional zone thickness. The thickness will be more than 12 millimeters. The junctional zone is just below the endometrium and it is hypointense. It is darker. Usually it has a thickness below 5 millimeters. But in case of adenomyosis, the thickness will be more than 12 millimeters. Here is another image of adenomyosis. We find ovoid, irregular shaped hyperintense cysts and a large junctional zone thickness. Adenomyosis is not very prominent in a T1 sequence. We see some hyperintense areas and increased junctional zone thickness, although it is not very clear. Here is a T2 sequence in axial view. It is much more clear in this sequence. We can see those irregular ovoid hyperintense cysts and a thick junctional zone. An endometrial polyp is a benign mass that is found in the uterine cavity, and it is attached to the uterine wall by a small stalk. The mass is hypointense in a T2 sequence, and here is the stalk. It is also hypointense. Usually the polyp is surrounded by hyperintense fluid, and there is also fluid in the pouch of Douglas. Here is a T2 sequence in sagittal view. We can see the hypointense polyp. Also there is a small hyperintense cyst. It may be seen in some cases. We can see a small stalk connecting it to the uterine wall. Endometrial hyperplasia is a condition in which there is an abnormally increased thickness of the endometrium. Usually it will be more than 15 millimeters, and in postmenopausal women it will be more than 5 millimeters. We will find a collection of hyperintense cysts and diffuse endometrial thickening in a T2 sequence. This thickening has smooth borders and it involves almost the entire endometrium. Here is a T2 sequence in axial view showing endometrial hyperplasia. We can see diffuse endometrial thickening. The entire endometrium is involved. This is a T2 sequence in coronal view. We see diffuse hyperintense endometrial thickening. In an ADC sequence, we will get a hyperintense appearance from the endometrial hyperplasia. This is in sagittal plane. Nabothian cysts is a term given to cysts that are found within the cervix. In this T2 sequence in sagittal view, we find multiple round, well-defined cysts in the cervix that are hyperintense. These cysts can be single or multiple. Here is another case of Nabothian cysts. We find some cysts within the cervix that are round, well-defined, and hyperintense in a T2 sequence. Cervical polyps are polypoid masses found within the cervix. They are also connected to the cervical wall by a stalk. In a T2 sequence, they will have a hyperintense appearance and smooth margins. And in some cases, the stalk may also be seen. Arteriovenous malformation occurs when there is an abnormal connection between an artery and a vein without a capillary in between. This is a gadolinium contrast T1 sequence. We will find flow voids which appear hypointense and look like this. These indicate arteriovenous malformation. Here is a T1 contrast-enhanced sequence in axial view. We find hypointense serpentine structures, these snake-like hypointense areas. These indicate arteriovenous malformation. This is a T2 sequence in axial view. We will still find hypointense flow voids in this sequence. These are the flow voids. This is a T1 gadolinium contrast sequence in coronal view. We can see these hypointense flow voids. Here is a T2 sequence in coronal view. These are the hypointense flow voids due to arteriovenous malformation. Cervical carcinoma is a malignancy of the cervix. We will see staging of cervical cancers. In a T2 sequence, they usually appear hyperintense. Stage 1A consists of stage 1A1 and 1A2. In stage 1A1, the deepest invasion measurement is usually less than 3 millimeters, and in stage 1A2, the deepest invasion will be between 3 to 5 millimeters. Here is stage 1B. In stage 1B1, the greatest dimension of the tumor is less than 2 centimeters. In stage 1B2, it will be less than 4 centimeters, and in stage 1B3, it will be more than or equal to 4 centimeters. Here is another image of cervical carcinoma. It has irregular borders and is hyperintense in a T2 sequence. This is a T2 sequence in axial view showing cervical carcinoma. It is better seen in a sagittal plane. We can see normal hypointense cervical stroma around the mass. There is no disruption of the cervical stroma. Hence, we can determine that it is a stage 1 carcinoma. In stage 2A, there is invasion beyond the uterus, but not into the lower third of the vagina or the pelvic wall. There is invasion in the upper side of the vagina, right here. In stage 2A1, the measurement is below 4 centimeters, and in stage 2A2, the measurement is equal to or greater than 4 centimeters. In stage 2B, there will be parametrial invasion. The parametrium surrounds the cervix and connects it to the pelvis. So there is invasion of parametrium. We can also see irregular margins of the tumor. Here is stage 2B in sagittal view. The tumor has invaded the outermost layer of the cervix, that is the parametrium. Now we move on to stage 3. In stage 3A, there is invasion into the lower third of the vagina, and also there can be invasion into the uterine body. Stage 3B includes invasion into the pelvic wall and/or hydronephrosis or non-functioning kidney. The kidney may also be compromised in stage 3B. Stage 3C1 includes lymph node metastasis. We will find enlarged reactive lymph nodes in the pelvis, which are normally not seen. This indicates that the cancer has spread to the lymph nodes. Here is another image of stage 3C1 showing pelvic lymph node metastasis. These are the enlarged lymph nodes. In stage 3C2, there is periaortic lymph node metastasis. We will find enlarged reactive periaortic lymph nodes. Stage 4 is the final stage. In stage 4A, there is bladder or rectal metastasis. The cancer has spread to the bladder over here and also to the rectum over here. This is a coronal view showing bladder metastasis in a stage 4A cervical carcinoma. Now we will look at the staging of endometrial carcinoma, starting with stage 1. In stage 1A, less than 50% of the myometrium is invaded by the tumor, and it will give intermediate signal. This is a T1 dynamic contrast enhanced sequence in sagittal view. The tumor is hypointense in this sequence. This is stage 1A. Less than 50% of the myometrium is invaded. This tumor is much larger and has invaded the myometrium to some extent. It has intermediate signal intensity. This is a T1 contrast sequence. The tumor has intermediate enhancement, and we can also see irregular margins, usually seen in a malignant lesion. This is stage 1A. In stage 1B, more than 50% of the myometrium is invaded. We can see an intermediate signal intensity mass invading the myometrium. This is a T1 contrast sequence. We can see the invasion of myometrium much clearly. In stage 2, the cervix is involved. There will be invasion of cervical stroma. The tumor has invaded the cervical stroma. The cervical stromal invasion is seen much clearly with T1 contrast sequence. This is stage 3A endometrial carcinoma. The cancer has invaded the serosa, the outermost layer of the uterus. We also see some irregularity here. Some irregular margins are seen. The cancer can also spread to the adnexa. This is a T1 sequence in axial view. The cancer is less prominent, but we can see serosal invasion. In this image, we can see ovarian metastasis. Both the ovaries are involved. This is a stage 3A endometrial carcinoma. This image shows stage 3B endometrial cancer. There is vaginal invasion. Stage 3C involves lymph node metastasis. In 3C1, there is pelvic lymph node metastasis, and in stage 3C2, there will be para-aortic lymph node metastasis. Stage 4A involves bladder or rectal or sigmoid colon metastasis. In this image, there is sigmoid colon metastasis. The cancer has spread to the sigmoid colon. In stage 4B, there will be distant metastasis. This could be abdominal invasion or inguinal lymph node metastasis. Thank you so much for watching. Please subscribe and stay tuned for more imaging videos.